reasons why I picked nursing was because I have two aunties in my family who are nurses. One is a breast health nurse and another one is an ID nurse. So my first choice was general nursing and I didn't get points for that. So I was chatting to my auntie who is the ID nurse and she just said go for it, and I just went for it, and it was the best choice. So the difference between ID nursing compared to the rest of them is we are looking after them in residential care and maybe even in acute settings. So with general nurses, they would see ID patients for maybe a couple of days or even a couple of hours, and then they just send them home, whereas they come home to us and we look after the care for hopefully the rest of their lives. Placement with student nurses is the biggest part of the course. So you're getting out there, you're getting stuck in with the hands-on, and you're learning from experience. The most toughest placement I found was a challenging behaviour house. So that has people in there who have behavioural concerns, but they have plans in there in place, and the plans are always followed and worked very well with the person themselves. Placements that I loved was I did my children's placement in Cootehill and Cavan, and it was a school it's a mix of primary school and secondary school with people who have intellectual disabilities, physical disabilities. So there was a group of nurses in there and they were absolutely amazing. They went around with kids who may have PEGs or if they're having seizures, they were there to support the kids themselves. And one of my special placements was in Portrane, which is a mental health institution. And I find that very interesting, completely different setting than what I was used to, as they were structured into one place, into different units, and it didn't, the comparison to intellectual disability was massive there. I'd like to gain experience as an ID nurse itself for 2 to 3 years to get that experience, and then I would like to broaden my education and go for maybe mental health postgraduates, because with the mental health placement in third year it really has given me more opportunities, or different postgraduates, everyone's different. Some of the girls are doing pediatrics with children. But I would like to gain my experience and maybe travel, but always come back and stick down here in Ireland.